Hi everyone, so my name is Nee and I am starting a new videos recording my cancer journey. So I was diagnosed with alveolar soft parts sarcoma, which is a really rare type of sarcoma, in 2016. So it's been 7 years now that I've been living with this cancer and doing treatments and just, nonstop pretty much. So I have been wanting to do this for a really long time. To record my experience and things that I've done that has been helpful or not helpful, just kind of ways to navigate through the cancer journey in general. So I have a background in medicine and I'm a family medicine doctor and I still work full time. So naturally, when I got diagnosed, I was very curious about all the things that I could do aside from just conventional treatment to help myself heal from the cancer. Of course, it didn't start off that way because when I was diagnosed, it didn't spread yet, or not that they had seen on the scans, but 4 months later, when they retrospectively looked back at my old scans, they saw that I did already have lung metastasis. So the primary tumor was in my right gluteus, just like a lump that I had for about 3 years that I completely ignored, and until it grew steadily, I didn't really get it checked out, and I actually got it checked out in my first year of medical practice after I had finished my residency. So this was when, I got diagnosed. So, of course, they removed it surgically, and I thought it was fine. I thought it hadn't spread yet, but of course, 4 months later, I developed 15 lung nodules, and that was probably the worst news because now I'm stage 4. So fast forward, I did a lot of treatments, mainly targeted treatment because chemotherapy and radiation does not work for my type of cancer. Radiotherapy does work, but it's not in the same way as like conventional radiotherapy. So it can kind of help with the symptoms, but it will not cure it. So I started this medication called Sutent, which we use for renal cell cancer, like kidney cancer. What it does is it blocks blood vessel growth and some growth factors that will cause the cancer to grow, and my cancer is very vascular, so that's why the medication works for it. It's not, it's one of the very few treatments that they have available for my type of cancer, but the problem with it is that it can cause resistance and lead to, it just works temporarily until it stops working, and then you have to switch to something else. So that's exactly what happened to me. I went on it for a couple years. I was actually pretty stable. Nothing else grew for about 2.5 years to 3 years. And so I could, because of the dose causing toxicity, I developed a lot of side effects that just weren't pleasant. And so I kept asking my oncologist to lower the dose. I was having pain in my hands and feet, it's called hand and foot syndrome. I was having a lot of stomach issues, GI side effects like, diarrhea, stomach pains, not being able to tolerate just eating. It just felt, so gassy and bloated every time I would eat. I had sensitivity in my mouth, and so it made it hard to eat certain types of foods, especially spicy foods. Things just tasted differently, and, my appetite just wasn't great. I did lose some weight from it. My hair turned white or, gray. And it's just like, I just looked really, really sick. So I didn't like the medicine at all. And I couldn't wait to lower the dose or get off it. So he kept lowering the dose. And ultimately, about 3 years into it, I, developed some bone metastasis in my sternum right here, in my spine and my right hip. So we switched treatments and we ultimately did some radiation to help with the bone tumors. And I went on this medication called Keytruda, which is an immunotherapy they had approved it for my type of cancer, or started using it for my type of cancer in 2016, which was when I was diagnosed, but it was relatively new. So this had become available by the time the medicine I was on, no longer was working. So he put me on that, and I was getting infusions every 4 weeks to start with, or actually every 2 weeks to start with, and then later on, we would have moved it to every 4 weeks. I was on it for about 4 months, and my follow-up scans just was way worse. The lung mets grew, and the bone tumors were continuing to grow. I had new ones. So it wasn't good, and so we added another type of targeted therapy that was similar to Sutent, which was the first medication I was on. It's called the tyrosine kinase inhibitor, so TKI for short. So I went on Votrient and combined it with the immunotherapy with the Keytruda, and that seemed to do something when he combined it with the radiation, but I ended up with pretty severe side effects, which we don't really know was from which medication. It was just a combination of them all, and I landed up in the hospital for 5 days. With the side effects. My liver enzymes were climbing, and they thought I had autoimmune hepatitis. I had a rash all over my body. And then I almost went blind, so that was not pleasant. I had fever, just like flu-like symptoms, just horrible pain because of the fever. And so ultimately they had to put me on steroids to reduce the side effects. And I was on steroids for about a month. So during that time, I was just really upset because I knew that the side effects, meant that the treatment was potentially working for me, and I was really hopeful that I could continue it, but the steroids, kind of came in and would dampen the immune response. So that meant that I would have to get off of it, plus any potential that it was working, it would stop because of the steroids. So I ended up stopping the immunotherapy, and then held the oral medication for a bit, and then resumed it ultimately with just the oral medication, the targeted treatment. And I developed some other bone metastases, in my skull that caused compression of my nerve, my right hypoglossal nerve, which is the one that basically innervates your tongue muscles. And so one day I just couldn't talk or chew because my tongue just wasn't functioning, and that's how we found it. And I had to get gamma knife, which is again radiation, to areas in the brain, except it's not actually my brain, it's my skull bone. So I went through that, and kind of just continued the treatment, but still things were not really looking better. It kind of stabilized for a little bit, and my cancer is very slow growing, so that's one of the things that's good about it. However, it's highly aggressive, and it just continues to spread, especially through the bloodstream, and you can get many tiny little microtumors that you don't see, and they'll eventually grow. So most people with ASPS, my type of sarcoma, will have to be monitored their whole lives because of that potential to continue to spread. So I ended up moving to California from New York because we had planned it to be closer to my family. And when we got there, that was when I was in really bad shape. I was having a lot of pain from my spine tumors, and the symptoms from my tongue. It was hard to eat, to chew. I had really bad TMJ on my right side because of the weakness in my tongue. So I had a lot of symptoms, that just was hard for me to do anything, to bend, to exercise, to go about my daily activities. And at this time, we actually had, a 4-month twin babies that I had through a surrogate. And so that we decided to have when I was stable for about 3 years. So we decided to get a surrogate and use our embryos that we froze before I started treatment. And then we have 2 wonderful boy-girl twins who are now 4 years old. So at that time they were 4 months, and so it was really difficult for me to be a mom and to work full-time, which I was still doing, and to just get through my day with this cancer. So I just felt like something needed to change. There was something of, I'm just not, there must be more. And I was just so fearful that whatever treatment I was on was, whatever it was doing at the time would eventually just stop working. So I decided to look into more holistic routes of healing. And that was when I started to read one book after another on cancer, and how to heal holistically with like integrative approaches, metabolic approaches. And so I read every single book I could find. I probably read like 30 books from, all types, like Chris beat cancer and the metabolic approach to cancer, radical remission. I'm sure you've heard of some of these if you've, kind of gone down the same path that I have. So, but many, many more books, and I just really poured my heart into it. And I started to meditate, I couldn't really exercise at the time, so I began with just swimming, and then ultimately I was able to get stronger and to be able to walk more. Then I started going hiking, I started doing yoga, I started just exercising a lot more, and I radically changed my diet, just completely got rid of every processed food, junk food, sugar, and just ate completely a vegan, well, more like vegetarian diet for 3 months. And I was juicing every day. I prepared all of this for myself with some help from my mom and my husband, and my mom was living with me at the time. So I really changed everything so radically. I even changed all my household products. I made sure they were non-toxic, things I was putting on my skin. The makeup was a little hard because I like to wear makeup, but I try to minimize it as much as possible. And eventually, I just kept at it, and I wasn't seeing much results until about 6 months in, when things kind of just started changing, and all of a sudden, my lung tumors were shrinking and they were disappearing. The bone metastasis had halted, and just my pain improved so much, my function, and I was getting stronger and healthier. And it was amazing. I felt like I was just, wow, I totally beat this. And this is, when I wanted to share with the world, and I wanted to kind of go into integrative medicine and ultimately, do that and kind of switch to that route instead of just being a primary care doctor. But unfortunately, I had kind of veered off my path, and my scans were not completely stable. I mean, it showed most of them were stable. In the lung mets, that was the most drastic. Out of the 15 nodules I had, they all disappeared except for 2 of them, 2 or 3. I still don't know because they read it differently every scan. But that was a huge thing for me because they had never disappeared. The bone mets were harder to measure because even if they're active or not active, you can't really see it on the scans. They still look like, it's a lesion. And I have mixed lytic and sclerotic. So lytic means the bone is eroded through, and it's like kind of like it's eating through the bone. And sclerotic is when it overgrows. So it's hard to tell, whether they're healing or not healing or what's going on with them. And I was doing a lot of PET scans at the time, which wasn't really the best scan to do for my type of cancer. But my oncologist insisted on just continuing to do those to keep it consistent. And she was not a sarcoma specialist. She worked with melanoma patients a lot. So I don't think she really understood exactly, what my disease was. She didn't really have much experience. I was probably the only patient she's ever had with it. And that's common with my type of sarcoma, where, the oncologist will not really ever have another patient. There's only about 80 cases a year in the US. So it's super rare. So I just kind of, got sick of doing whatever I was doing, and I was sick of being on treatment. I was on immunotherapy plus another TKI at that time, except it was something called axitinib, which is, similar to Sutent and Votrient. I didn't really have that many side effects on it. So I was actually doing pretty well, but she wanted to take me off treatment because she said it's been 2 years and my scans were really stable and nothing looked like it had changed. So she recommended to just get off treatment, and I agreed because I just didn't really want to be on the treatment anymore, honestly. I don't think that was the right thing to do just yet because, I still had some growth, especially in my skull tumor that they thought might have been inflammatory due to the radiation. They weren't sure if it was actually growing or not. And then, I had some other bone meds, like I started having pain in my right hip, and I thought that it was just from my previous surgery and that my leg had started to get weak on that side. But it was actually bone metastasis in my femurs that the PET scan did pick up, but they just didn't really mention the size of it or severity of it. And they kind of just said it, it was active in both of my femurs. And then my oncologist kept thinking it wasn't cancer related, that it was just reactive. So that's the thing with the PET scans, is sometimes you can't really tell if it's just a reactive thing or if it's actual, activity from tumor growth. So I ignored it, I didn't think it was tumor related. So I had this false sense of security that I had healed from this, that immunotherapy is long lasting, and if it did work for me, it should continue to work for me. That's why they stopped it after 2 years. But unfortunately, that was not the case. We ended up moving again from California to Georgia. And this was during that whole time. And so I was super busy, trying to change my jobs, going between jobs. I was just doing a lot of, focus. A lot of my focus was on moving. And so I just kind of let my health be in the back burner. I stopped exercising as much. I had stopped doing meditations. I had stopped eating strictly. I would find myself cheating a lot, eating outside foods, eating processed foods, sugar, more like carbohydrates, because I don't really like sugar that much, like in terms of sweets. But I just basically didn't care, and all this time I kind of felt worsening symptoms. Like, I was developing a limp from the pain that I had in my hip, and that kind of limited me too in terms of my exercise and, not being able to hike or run or exercise because of the hip pain. But again, I just kept brushing it off, thinking it was fine, and, I would address it when we moved to Georgia. So it took us quite a while to kind of adjust, and we had just moved there. It'll be like a year next month, so we moved there in November 2022. And so, so basically from there until now, it's been quite an adventure, with my cancer progressing. And having to go through a lot, which I will probably record in another video because this is getting really long now. But, you know, the main objective is just to give you a background of my cancer. I try to do it really fast, but there's a lot more details, you know, that I'll include in my future videos, to kind of like go back to specifically the things that I was doing and what I felt worked for me, and things like that. So thanks for listening, and I look forward to posting more videos. I'm going to try to be really consistent with this to share whatever I can with you all. Okay, have a blessed day.